I'm here with Dr. Ben Tittle, board certified plastic surgeon in Dallas, Texas. Dr. Tittle, thank you so much for being with us. I'm wondering how the profession of plastic surgery has changed since 1989 when you became board certified. You've seen quite a bit of changes in those years, haven't you?
Seen changes in technology, but one thing that doesn't change is you want to do the best thing for the patient. You want to evaluate each patient individually so that you give them the options that are best for them. The things that have changed are not everyone has to have surgery now. There are non-invasive treatments that work very well so that the patient doesn't have to undergo surgical procedures to get an improvement.
When people come into your office, everybody talks about your incredible bedside manner. You see it on all the reviews about your practice. What is your philosophy about how you deal with individual patients?
Well, that's very nice of you to say, Tony. I read somewhere that the patient is interrupted in less than a minute after the physician asks them why they're there. I care about patients. I listen to them. I treat them as I would a family member. I try to let the patient explain to me what they're here for so that I can get a better idea how I can help them.
One of the most popular treatments on the market now is a treatment for cellulite. Explain this new procedure.
Yes, Cellfina. It's very exciting. One of the holy grails of plastic surgery has been how to treat cellulite, and this device effectively treats it. Cellfina cuts those fibers and makes the skin smooth.
Can you do that in a single procedure here in the office?
Yes, I do it in a single procedure. This is what I call minimally invasive. You have to cut the bands, and to do that, there's going to be some swelling and bruising. And it was with everything. Some people swell and bruise more than others, but patients that do it under local have it done and they drive home.
And finally, Dr. Tittle, I think it's really important for people to understand that you are a board certified plastic surgeon. You have your own operating room here that we're seeing behind you. Why is it so important to emphasize that for patients who are seeking these kinds of treatments? Because
I'm able to offer the range of procedures to them, to give them options, and then to do it in an environment that's safe and comfortable. My operating room is set up for their safety and comfort completely, and so then that maximizes their experience so they're comfortable during the entire process.
Dr. Tittle, thank you so much for having us in.
Thank you very much, Tony. It's always a pleasure.